Okay, here's our video today. Draculin Therapy. And it has nothing to do with Dracula. Well, in a way, the name has to do with Dracula. Draculin, by the way, is vampire bat saliva, which we'll talk about in this video. So our little friends, the vampire bat, let's get a picture. Here they are. They're about 3 inches long, found in the tropical rainforests and deserts, Mexico all the way down South America, and some have been seen in Texas. And the thing about the vampire bats is that they feed on blood. So let's write that down. Feed on blood. And that's all they feed on. So, and if you feed on blood, you're a sanguivore. That's right, not a carnivore or herbivore, but a sanguivore. So let's write sanguivore down. The sanguivores, which are also like leeches and ticks, and some fleas, sanguivore, feed on blood. And let's write down also that they can be anywhere from 2 to maybe 4 inches long. So they're tiny, but they have really sharp teeth. But if they bite you, you probably wouldn't feel it because it's painless. So in the saliva, and what was the name of the saliva again? Draculin. That's the saliva. That saliva will numb the area. And they don't really go after humans too much. But if you're out there and they're hungry, you're a meal, just like mosquitoes and ticks. So it's possible that you don't even know that they're sucking your blood. And they could feed anywhere between 5, 10 to 20 minutes or less, and they can take 2 to 4 tablespoons of blood, those tiny little creatures. So if you think about it, how are they helpful? And there's a cow or a goat, whatever creature that is. There it is, if you can see it, just hanging on. The creature probably doesn't even know, having a good time, having its dinner. So again, how can these vampire bats help us? Remember, this is Draculin Therapy. So when we get hurt, let's say we have a cut, we have a paper cut, right? And we go, ouch. What happens? There's our paper cut. Maybe a little more than a cut. So, that hurts. We say ouch, and our body will start to heal, right? We're going to heal the wound. Well, your body will heal the wound. And maybe we'll change it to green. And if you can see over here, these are the platelets that we have in our blood, the platelets. And these platelets in our blood will be activated. And the platelets, they kind of stick together as you're seeing in the picture here. It's like glue. They stick like glue. Let's put that down. They stick like glue. And they're healing the wound. They're going to seal up the wound. They're going to plug up the wound. And they call it a platelet plug. So let's change the color. Over here, a platelet plug. So remember, these platelets are in us, and we have platelets when we have a wound and we get an injury. We can clot the blood. That's the main thing. We don't want to keep bleeding. And you know that eventually you'll have a scar and a scab. So the platelets will help stop the bleeding, and then they'll also activate something else. They're going to activate, well, right here, they're going to activate, well, it's called factor X. And I'm simplifying this video here. So factor X, and not the X-Men, nothing to do with the X-Men. Factor X will help stable blood clots, will help form a stable blood clot. So it's important that we clot the blood, and we want a stable one. So they'll help, factor X is going to help form a stable blood clot. So sometimes we need blood clots to stop the blood, stop the bleeding. And factor X will also strengthen the seal that the platelets did. So they also will strengthen, right over here, they'll strengthen the seal, make it stronger, promote healing. Strengthen the seal and promote, will we fit it? promote healing. We'll go a little off. There we go. So factor X, so again, just to review, the platelets will stick like glue and they'll form a platelet plug. They'll activate factor X, which will help form a stable blood clot, and they'll strengthen the seal and promote healing. Now getting back to our vampire bat. In the vampire bats, the saliva, remember the Draculin? The saliva in the vampire bats, it acts as an anticoagulant. And it has these substances in it that stop the wound from clotting. So when a vampire bat bites you, they don't want a blood clot. They don't want the platelets to form a plug because they want more of your blood. So they have this anticoagulant properties, the substances, and that will stop the wound from clotting until they stop feeding. So when they stop feeding, then the platelets will come back together and create the platelet plug. So why is that important? Well, let's write it down too. Stick with red. Blood theme. So the saliva, the vampire bat saliva, remember it's called Draculin. So I guess Dracula is involved in this. So that saliva, the saliva, it has these anticoagulant properties. There we go, try to spell it right. Anticoagulant substances. And these substances gotta get the will in there, will stop the wound from clotting. Remember, they could be on you or on an animal for anywhere between 10 to 20 minutes. So they'll stop the wound from clotting until they're done feeding. And when they're done feeding, of course, the platelets will again create the plug and so forth. So again, how can this help us? Now, researchers are researching into Draculin because there are some people who have compromised systems, like the elderly, for example. Sometimes if you sustain a traumatic injury, you may have blood clot issues. And that, if you have blood clots which you don't want, that's called thrombosis. So let's put that there, thrombosis. And you can have some dangerous blood clots deep in your veins. And again, these can be caused by major injuries, major falls, or compromised systems. So if you know people who have a compromised system, perhaps these researchers could use Draculin, and perhaps, I'm saying, this is not a health video, to get rid of these blood clots. Because, again, blood clots could be dangerous. They could disrupt the blood flow in the body. So the key takeaway on Draculin therapy is to use Draculin, perhaps, that can help people with blood clot issues like thrombosis. Also, there have been documents of the elderly who are inactive, and they have a chance of getting blood clots from being inactive. And so what Draculin could also do, not only could it help stop blood clots, but it could perhaps help with blood flow, which could be very important for the elderly and those who have thrombosis. So that's our video today on Draculin therapy.